Hi friends, today is the topic of alimentary canal, the main pathway for the digestion. We explore these organs and the structures so you can easily apply this knowledge in the clinical situations like assessing the GERD and post-operative GA care, and we can apply this. So let's go into the topic. By the end of sections, you will be able to describe the alimentary canals and these are anatomical knowledge so that you can easily apply in the clinical scenarios. We all know the digestion start from the mouth. So first is of oral cavity, then the esophagus, how we are going to see about the small intestine, large intestines and the esophagus. So let's go into the topic. The alimentary canal is also called as a digestion tract, and this is a continuous muscular tube starting from the mouth and ending to the anus. It's about 9 meters long and in the adults. Food enters here and get digested mechanically and chemically, and nutrients are absorbed and the waste is eliminated. This tube is lined with a mucus and has layers of muscles for the peristalsis, the wave like a movement that pulls food along. And in nursing, remember any disturbance like of abrasions or the tumors can cause the obstructions and which is of leading to the pain and vomiting and constipations, which is a key signs for watching for. These forms the core pathway for accessory organs like salivary glands, livers, and pancreas and gallbladder, which aids the digestion but are not part of the canal itself. And these are the main organs of the alimentary canal, and accessory organs are the separate one. Just pause it and look into the picture that first one is of mouth and second is of teeth and third is of salivary glands and fourth is pancreases, and each number each of the part name is of given in below, and just look into it and memorize it. Now it's of oral cavity, which includes the palate and which is of roof is hard and soft, and tongue, which is of muscular organ for taste and speech and swallowing, and teeth for chewings, and of the tongue is of upper surface for as the lingual papillae, and circular is of large, which is of V-shaped at the back, and many which has of taste buds. Clinically, poor oral hygiene here can lead to aspirates and pneumonia in bedridden patients. So oral care is a crucial and important in nursing care. What we have seen in the previous slides is the same of anatomical location where the lip and the teeth and the hard palate, soft palate where is located, and the floor of the mouth, just view into it. Pharynx is a common for food and air. The epiglottis act like a lid which is preventing the food entering the trachea during the swallowing. And aspiration this is high in the stroke and unconscious patients. And the esophagus is a 25 centimeter muscular tube that carries the bolus from the mouth to the stomach basis of peristalsis movement. And the gastroesophageal sphincter, which we can refer to as a lower sphincter, which is preventing the food entering to the esophagus return. After the food enters the stomach, it was preventing the backflow of the food to the esophagus. So when the weakness is occurring in the sphincter, which causes the weakness here, this weakness which may the complement complaint which causes a GRT. And so we have to teach the patients about this. Whatever you see in the previous, there's a picture, visualized picture, the esophagus and cardiac fundus, body of the stomach, how it's the curve, the lesser curvature and greater curvature, so how is entering the duodenum. The sphincter is located where the cardiac and the esophagus, the curving, the lower sphincter esophagus is present. So it's preventing the food enter back to the esophagus. The stomach is a J-shaped muscular bag in the upper left abdomen. It has 4 parts, which is of cardiac, near heart, and entry of the point. And fundus is the top and store gases, and body is the main mixing area, and pylorus is of which consists of lower and control to the which is a exit to the duodenum. Which is the duodenum is a small intestine first part. It chews the food into chewing gum, and which is of secretes acids and pesticides. And in nursing, think about peptic ulcer and gastric outlet obstructions or post-gastrotomy dumping syndrome. These are the diseases which occurs in the peptic ulcers conditions and where the part of small intestine. The small intestine is the largest part, which is of approximately 6 meters and main site for digestion and absorption. The three sections of the main is of small intestine: duodenum, first of 25 centimeter and C-shaped, receive bile and pancreatic juices. And jejunum is a middle and most absorption is take place. And ileum is of terminal and absorbs a pH well and of bile salts. And huge surface area comes from villi and microvilli. Conditions like chronic or iliac diseases affect this area, which is of malabsorption site. Whatever we have seen today as a video, this is just like a mind map. Refers to it. This is the reference. We can refer it. That's our quick overview on Alimentary Canal. Understanding this helps in every GA assessment and innovation. Drop your questions in the comments, share with your classmates, and subscribe to the Yaznexaspark for more video. And let's heal and learn together. See you in the next video. Take care.